When you're ready to adjust a patient's position, provide privacy and perform hand hygiene. Then introduce yourself and identify the patient.
Roland Jenkins, 10362.
Okay.
To place your patient in the supported Fowler's position, begin with the patient supine. Raise the bed to a working height, and then raise the head of the bed to a 45-degree angle. Rest his head against the mattress or on a pillow.
Let's reposition your pillow. Is that better?
That's much better, thank you.
Okay. Would you like a pillow behind your back?
No.
Okay.
If needed, position a pillow or rolled towel at his lower back. If he doesn't have voluntary control or use of his hands or arms, use pillows for support. Place a pillow or roll under his thighs and support his calves and ankles with a pillow or roll. When necessary, place pillows or rolls at the feet to keep feet properly aligned and maintain dorsiflexion of the feet.
I'm going to cover you back up.
Hi, Patty. I'm gonna make you a little bit more comfortable, okay?
To place your patient in the supported supine position, lower the head of the bed so that she's lying flat.
Would you like a lumbar pillow behind your back?
No, thank you.
No? Okay.
Place a small rolled towel at the lumbar back if needed. Put a pillow behind the upper shoulders, head, or neck if needed. Rest her pronated forearms on pillows, keeping the upper arms parallel to the body. Place trochanter rolls or sandbags parallel to the lateral surface of her thighs. Protect her feet with a small trochanter roll or therapeutic boots. Finally, place the fingers and thumb of each of the patient's hands around a rolled cloth. To move your patient into the prone position, make sure the bed is flat and remove the patient's pillow.
Pull the covers down. And we're going to take these pillows.
Lower the side rail and move the patient to the side of the bed opposite from the direction you will turn him. Move his upper trunk first, supporting his shoulders, and then move his lower trunk, supporting his hips. Finally, adjust his legs and feet to maintain good body alignment. Stand on one side of the bed and ask another nurse to cover the other side. As you roll the patient, the arm on the side to be turned should be held alongside the body. Place a towel or pillow beneath his abdomen, below the level of the diaphragm. If he has hemiplegia, be sure you're moving him onto his unaffected
On
side.
the count of 3, we're going to have you go to your right.
Then roll the patient's body over that arm. Be sure his elbow is straight and his hand is tucked under the hip. Once he's on his abdomen, center him in the bed to maintain good body alignment. Turn his head to one side. He may wish for a flat pillow, a folded blanket in a pillowcase, or to lay directly on the mattress for comfort. Support his arms in the flexed position at the level of the shoulders. To elevate the toes, gently wedge a pillow beneath his lower legs.
I'm going to cover you back up.
If you need to move the patient into a 30-degree lateral or side-lying position, after raising the bed to a working height, lower the head of the bed completely, or as far as the patient can tolerate. Then lower the side rail.
Take your hand off the pillow.
And position her on the side of the bed facing in the opposite direction toward which she will be turned.
Bring your legs towards me.
Flex the knee that will not be next to the mattress. Place one hand on the patient's hip and one hand on her shoulder. Then roll her towards you onto her side. Place a pillow under her head and neck. Next, place your hands under her dependent shoulder or the one next to the mattress and bring the shoulder blade forward. Place both of her arms in a slightly flexed position. Put a small tuck-back pillow behind her back. Make one by simply folding a pillow lengthwise. The smooth area of the pillow will be slightly tucked under her back. Support the upper arm with a pillow that's level with the shoulder. The other arm will be supported by the mattress. Slide your hands under her dependent hip and bring the hip slightly forward so that the angle between the hip and the mattress is about 30 degrees.
I'm going to elevate your legs with a pillow.
Then place a pillow under her semi-flexed upper leg at the level of the hip, from groin to foot. Maintain the foot in dorsiflexion by supporting with sandbags placed parallel to the plantar surface of the dependent foot. Use ankle-foot orthotics if you have them available. You might need to place your patient in the Sims semi-prone position. Place the patient in a supine position on the side of the bed opposite from the direction you will turn him. Remove the pillow. The patient's arm on the side to be turned should be tucked alongside the body. Flex the knee of the leg that will not be next to the mattress. Then turn the patient onto his side. Position him in the lateral position, lying partly on his abdomen. Slip a pillow under his head and a pillow under his flexed upper arm, supporting the arm so that it's level with the shoulder. Next, place a pillow under his flexed upper leg, supporting it so that it's level with the hip.